Hi everyone, I'm Sagree. Thank you for joining me again. Today I would like to discuss with you some of the suggestions that came across via email, and a lot of people have been requesting for me to discuss how do they maximize their time um, with the rheumatologist. How do they maximize the rheumatologist visits? So I've put together a few tips that I take into account when I need to see the rheumatologist. Um, we do have a very limited time with the rheumatologist. Most appointments are about 20 minutes, and there are a very limited number of rheumatologists available. And you and I that are familiar with rheumatology, we know that even though we are known to the practice, it is still difficult for us to get an appointment if we need one. So there are a few reasons that you would need to see a rheumatologist, and perhaps you were referred by a family practitioner um, because of persisting symptoms that you are experiencing. Perhaps your blood work indicates that you need to see a rheumatologist. So sometimes when you go to EC with other illnesses and other symptoms, you may be referred to a rheumatologist. And so today I want to give you a few tips on what to discuss at your rheumatology visit um, and what you need to focus on. I've had lupus for 8 years now, and I can tell you that the consultation time is not enough for the number of things that we need to discuss and we need to cover, because when you get there, I'm sure if you have been for your visits, if you're an existing patient or a newly diagnosed patient, I'm sure that the night before you need to see your rheumatologist, it is a very stressful um, thing to do, because you're trying to remember everything that has happened. You're trying to think of if there's anything that you've missed out, and it is really tense, it's really stressful. So I like to keep a little notebook in my handbag, and what I do with that notebook is I take out the notebook whenever I think of symptoms that are new or persisting symptoms, or if I've been started on new medication, I think about symptoms that have come up that I'm really battling with, to see if I can speak to doctor and maybe she can change the medication or try something different, maybe take it at a different time. So these are the reasons why we need to document things, because we cannot remember every detail of what we suffer with lupus. And you and I both know that lupus is very individualized and it is not the same every day. We don't know what symptoms are going to persist on any given day. So it's really difficult to remember with the brain fog that we experience as lupus patients. Um, and we see our rheumatologist or once every 4 months, or sometimes twice a year, depending on what your medical aid allows. And you can imagine in between that time how much happens. And when you get to your appointment, all of the things that you are discussing with your rheumatologist is not currently happening. You are talking about symptoms that you've experienced or negative um, uh, experiences that you've had during the time you have not seen her. I suggest that you take pictures if you have a rash that you cannot really explain, um, but just to give a better idea as to what happened and what you experienced. Um, so on the day of the appointment, you definitely not gonna have the same symptoms that persist, but you're gonna make reference to that because it's important. Be honest about how you're feeling. When your doctor asks you how you're doing, don't downplay your symptoms. Don't make it seem as though you're coping if you are not. You need to be honest. You need to um, consult a doctor, a rheumatologist who has empathy, somebody who listens to what you have to say and doesn't make you feel like you're crazy. I know from speaking to a lot of lupus patients over the past couple of years, a lot of them are very unhappy with the rheumatologist they've chosen. And I always tell them that it is absolutely fine to get a second opinion. Remember, you are paying a lot of money for these consultations. Um, and you need to be happy when you leave the consultation room that most of the questions you have asked have been answered, that your mind is at ease. You don't need to leave there feeling like um, you're just imagining all of these things. And I feel that you must be able to have a stress free, two-way conversation about all the things that trouble you that you cannot tell others about. Talk about your symptoms, even the ones that are weird. Ask the stupid questions, even if it seems stupid to you or to others, it doesn't matter. Ask the question anyway. Talk about the effects of your new medication, lifestyle modifications that you have made. Talk about multivitamins. I know lupus patients are always wondering what's safe for them to take. Discuss those things. Uh, Discuss stress factors that you've been experiencing over the period where you've actually presented with symptoms that came up as a flare because of the stress that you were under. Um, and whilst you are speaking to doctor during the consultation, there might be periods where doctor will tell you that she feels she needs to refer you or he needs to refer you to another specialist. Make sure that you have options. Make sure that you question the risk and the benefits thereof. If you require surgical intervention, if it is not an emergency, you don't have to make a decision immediately. For example, I had a facet block on my spine in June and it didn't work. So I had persisting lower back pain. My lumbar spine is really troubling me, and doctor suggested a rhizotomy. But in between suggesting the rhizotomy, we were already planning for me to go into hospital to have my biologic infusion. And I knew that it was already going to be really taxing on my body, that I don't take well to the infusion, that I become immunosuppressant and I get really ill. I feel very fatigued after the infusion. And so I said to her, look, I don't think I could have the rhizotomy now. I really think I want to have it at a later time. And my doctor listened to what I had to say. She heard me out, and we both came to the understanding that I'm not saying that you are making a wrong suggestion. All I'm saying is that I feel my body needs to take a break in between the infusion and the procedure that I need to get. So that is what I'm talking about. You need to have a rheumatologist that you can speak to, and you have that mutual understanding that is very important, so that you don't feel forced into anything that you're not ready for. I know my doctor is always very understanding with me because I always say that surgical intervention for me is always the last option. I always tell her, let us exhaust all our options, make sure that we've tried everything else, and surgery must be the last option. And most of the time, whenever I had surgery, it was always an emergency. You may also write down what doctor is saying because it's too much information at once. Imagine getting all this information in 20 minutes. You're not going to remember everything. There's no way. And we become really forgetful because you're trying to focus on what doctor's saying. You're also at the same time trying to remember the things that happened in between the last time you saw her to the time you're seeing her now. If you're a new patient, you're also trying to figure out this doctor, her personality, what she like, and then you're still trying to figure out everything else at the same time. I also suggest if you can get somebody to go to the appointment with you, do that. Take somebody with you so that they can remind you of the things that you forget, and they can also be somebody who will just sit and listen to the things that you're probably going to miss. Make sure to discuss all your medications, and if you need to make adjustments to your medication, make them then and there. Ask doctor about changes in your blood results. Make sure that you are compliant with your doctor's visits. Do not skip your appointments as they are extremely crucial to your well-being. During the clinical examination, be sure to show doctor any skin rashes that you may have. I always, that is the time I show her the bald patches that I have on my scalp, because with lupus we also get alopecia, and I've been experiencing that a lot. And also, this will be a nice time to show her the areas of where you are feeling extreme pain, severe pain, so that she can look for inflammation, etc., because they look for specific things that we miss. Don't ever feel pressured to to tell doctor that you are coping when you are not coping, because you could actually be suffering in silence when you could actually get some help right there. When you receive your prescriptions, please ask doctor what are the common side effects that you would experience, and also because you know that if you are a medical aid patient, medical aid does not approve of all the medication that we are prescribed. Ask doctor what are your options if it is denied. Make sure to leave the doctor's rooms with a new prescription, a new date for your next visit, blood forms if you require blood work to be done prior to your next visit. Don't ever leave your appointment feeling confused or agitated or frustrated because you did not maximize the time allotted to you. That is why it is necessary to use these tips for your next rheumatology consultation. I promise you it will go much more smoothly. This is what I adopt for my own life, and I'm sure that it's going to help you as well. Remember, lupus is really complex. There might not be an answer to every one of your questions. If you're going to receive results, please be accompanied by somebody. If you're going to receive cortisone injections or infusions at doctor's rooms, make sure to arrange to be picked up, as it is safer for you to not drive. I hope these tips were helpful to you. And whether you see a private rheumatologist or a state rheumatologist, maximize your time and make these visits a pleasant experience for you and your doctor. If you are well and have no questions or concerns, that is all good and well. I hope this has helped somebody out there today. I just want to let you know, many people have been asking me about my book. This is my book, The Show Must Go On. You probably hear me making reference to The Show Must Go On quite often. And if you want to purchase this book, you may get your copy on my website, which is www.theshowmustgoonbook.co.za. And thank you for your comments. Thank you for your emails telling me about how much this channel is helping you. And please share this with other people that you know that have lupus or might be going for a consultation and are quite confused as to what questions to ask, what to remember, what to jot down. Making notes is always helpful. I do that every single day as I cannot remember everything that I need to do. And there's absolutely nothing wrong with that. Hey, until next time, I want to wish you good health. I want to wish you a pain-free time till we meet again. And remember to keep the faith, to keep taking it one day at a time. The show must go on. Thank you guys. Until we meet again. And once again, everything that has been discussed here today, all of the details I've shared are details and are opinions that I have based on my experience with lupus. So please do not replace it with any of the advice given to you by a healthcare professional. Thank you so much. God bless you. Until next time, keep the faith. Bye.